Myasthenia gravis is an autoimmune disease where the body produces antibodies that destroy acetylcholine receptors at the neuromuscular junction. Specifically, the ligand-gated ion channels that are located on the motor end plate at the neuromuscular junction. These ion channels need to open in order to allow sodium to flood in, to depolarize the muscle membrane to facilitate a muscle cell contraction. If the acetylcholine receptors cannot dock to open these channels, then a muscle contraction cannot occur. Myasthenia gravis etiology. It is a rare condition. Incidence is 14 to 20 per 100,000 in the United States. It can occur at any age or manifest at any age, and there's a 2-to-1 female to male ratio in the younger adults, but in older adults, more than 50% are male. I like this photo on the right because it shows an elderly woman, a young teenage boy, and a dog, because myasthenia gravis can affect the old, the young, and the animal. Thymic abnormalities associated with myasthenia gravis. About 10% of patients who have MG will show a thyoma, an epithelial tumor of the thymus gland. And if that is removed, it cures them of the myasthenia gravis. About 30% of young people who have myasthenia gravis will show a thymic hyperplasia. And this hyperplasia, if the thymus gland is removed, it cures them of the MG. Hyperplasia of the thymus gland, though, is not seen in older individuals with myasthenia gravis. Some of the clinical features associated with myasthenia gravis is end-of-day muscular weakness and exercise-induced weakness. The signs can be diplopia, weakness of the eye muscles, or ptosis, weakness of eyelid muscles. One of the key symptoms that a patient may relate is that I wake up in the morning feeling okay, fine, reasonably strong, and by the end of the day, my muscles just get weaker and weaker, and my eyelids will just close on me even though I'm not tired. To distinguish this condition between multiple sclerosis is that multiple sclerosis, they will present with weakness throughout the day, that at the end of the day really does not change or increase their muscle weakness. To distinguish between the visual problems, MG patients will just have the eye muscle weakness, so they might not be able to perform an H exam, but they can still see just fine as long as their eyelids are open. Whereas multiple sclerosis will have visual problems because of optic neuritis that's associated with MS. Other signs and symptoms with myasthenia gravis is dysphagia. They will have problems swallowing, and that's because it takes muscles to swallow. Problems chewing. Dysarthria, they'll have slurred speech or altered speech. The photo you see on the right is of a young lady who has myasthenia gravis, and I have a video posted of her trying to talk about her condition, and you'll be able to clearly understand what the dysphagia and dysarthria are in this video. It presents pretty well. They'll have loss of facial expression because it's going to affect the facial muscles, weakness in the neck and upper limbs. So myasthenia gravis, it really strongly starts to affect from the top down. They cannot maintain their posture, shortness of breath because of the weakness of the intercostal muscle, waddling gait because of the weakness of the hip flexors. Once you suspect myasthenia gravis, it's very easy to get a confirmation diagnosis with a blood test. It is often misdiagnosed because, again, the first symptom is just muscle weakness, and you'll discover in some of the videos that I have presented up there for you to view with people with myasthenia gravis that it was missed in the beginning, and these young women were just told, well, maybe you're anemic, or maybe you just are pushing yourself too hard because you're an athlete. And it's not till the symptoms really become very strong that they get properly diagnosed. But the antibodies to the acetylcholine receptors are easy to find on a blood test if that's what you suspect, because it's not a common test that you would just do checking someone's blood. Another very interesting way to diagnose myasthenia gravis is they would inject a person they suspect having this with a drug called endophoneum chloride. It is a cholinesterase inhibitor. So that keeps the acetylcholine in the synaptic cleft longer. It prevents it from being broken down. So as subsequent signals are sent to the neuromuscular junction, the few remaining ligand-gated ion channels that still have functioning acetylcholine receptors working can stay open longer, and their symptoms go away immediately. It's pretty interesting to watch this happen, where they're injected and their symptoms go away. But it is temporary, unfortunately. Tests that are also used to confirm the diagnosis is a nerve conduction velocity, where it is the action potential, the timing of the action potential, the velocity of it from one point to another is measured. As you can see, it's going for the ulnar nerve from the olecranon fossa joint to the tip of the fifth digit. And then the electromyography, which measures the response of the muscles. So muscles need to be innervated, get a proper signal to contract, and then the muscle itself has to contract. So having these two tests can distinguish between, is it just a nerve problem, or is it just a muscle problem, or both? So treatment for myasthenia gravis, the condition can be managed, and it's managed either with cholinesterase inhibitor drugs. One of them is mestinon, and then the endophoneum chloride that I talked about earlier. It's also corticosteroids such as prednisone, because corticosteroids suppress the immune system, or they can use some other immunosuppressive drugs. The thymectomy, sorry about that, the thymectomy that I talked about earlier, where they remove the thymus if there is a cancerous tumor or hyperplasia, and plasmapheresis, which is very effective treatment for anyone who has an autoimmune disorder, where they just clean out the plasma. They run it through these filters, and it's very similar to dialysis, and they take the blood and they clean out all of the antibodies. The prognosis of myasthenia gravis is that it's not fatal, and individuals can have a normal lifespan. Some individuals will have periods of remissions and exacerbations very similar to multiple sclerosis. Severe cases may require immediate medical attention, especially if it targets your muscles of respiration. And just as a side note, the character Sleepy in Disney's Snow White and Seven Dwarfs was supposedly drawn after a friend of Walt Disney's who had myasthenia gravis. Botulism is a rare, serious, life-threatening condition caused by a neurotoxin that's produced by a bacteria, Clostridium botulinum. Clostridium botulinum is a toxin-producing, lethal, gram-positive, rod-shaped, spore-forming, hardy, anaerobic bacteria that's found worldwide in soil and marine sediments. Mainly, the little booger is everywhere, and it is very hard to kill. Clostridium botulinum has two stages of its life cycle. One is a dormant stage when conditions are unfavorable, such as in a drought or acidic condition or very cold condition. And when those conditions are present, it'll go into a spore formation. Spores are dormant Clostridium botulinum organisms, and they can live, I believe, forever, and they are so hard to kill. When conditions become favorable again, such as warm, moist, not so acidic conditions, then the spore will start producing the toxin, the botulinum toxin. So what you have to do is prevent yourself or be cautious of not ingesting the toxin, because that's what can kill you, not the spore. Where do spores germinate? In warm, moist, anaerobic, low acidic environments, such as improperly canned fruits and vegetables, or in a wound, or in a baby's intestines. Botulism toxin targets cholinergic neurons. It binds to presynaptic surface or membrane of all peripheral nervous system cholinergic neurons. It attaches to the synaptotagmin of the forming vesicle to enter the neuron via endocytosis. Do you guys remember from neuro and muscle physiology the process of the vesicular cycle? Well, there's the one part where the axon terminal will recycle a vesicle after it's released its neurotransmitter, and it does this by endocytosis, and that's how the botulism toxin gets into the cholinergic neuron. This will prevent fusion of acetylcholine vesicles with the presynaptic membrane, because once inside the neuron, the toxin will cleave synaptobrevin, which is a V-snare, on all the vesicles that are in there. And once their V-snare is snipped off, they will not be able to bind, and then that particular axon terminal is no longer function, and no acetylcholine will be released. So what sites are affected? All somatic neuromuscular junctions are, because they are all innervated by cholinergic neurons. All autonomic ganglion synapses are affected, because all preganglionic neurons release acetylcholine. And all parasympathetic postganglionic and target cells synapses are affected, because all postganglionic parasympathetic neurons release acetylcholine. The progression of the toxin starts with the cranial nerves and migrates down the cord. Cranial nerve signs and symptoms of botulism is ptosis, and it is bilateral. So all these signs and symptoms are bilateral when appropriate. So you'll have drooping of the eyelids. Diplopia, it's going to affect cranials 3, 4, and 6, and then give them double vision. Right there, the first two sounds like myasthenia gravis, but this comes on suddenly where MG does not. Exerostomia, which will affect cranial nerve 7, causing dry mouth. Dysphagia is going to be cranial nerve 9, 10, and 12, cause difficulty swallowing. Dysarthria is affecting cranial nerve 12, giving them a slurred speech. Dyspnea, cranial nerve 10, that's going to cause difficulty breathing. The larynx will close. It also involves the phrenic nerve and the intercostal nerves, and that's going to cause vomiting, diarrhea, and constipation. Typically, vomiting is the first symptom, because the body wants to get rid of as much of that toxin from ingesting as quickly as it can. General signs and symptoms of botulism is bilateral muscle weakness. And this muscle weakness can be so weak that it presents as paralysis of the muscle. Again, the progression is top, down, and out. It'll start in the face, spread to the trunk, and then out to the extremities. It's kind of the opposite as Guillain-Barré symptoms. It generally, though, doesn't affect your heart rate or blood pressure or even cause a fever unless it's wound botulism. There are types of ways of getting botulism, and the most obvious is foodborne, and that is from eating contaminated food. Wound botulism, infant intestinal botulism, iatrogenic botulism, and inhalation botulism. Foodborne botulism cause and onset. Well, ingesting contaminated food is the number one way to get botulism. You're either ingesting low-acid commercial or home canned foods that are contaminated, or inadequately cooked food, And another way that I don't have mentioned here is properly cooked food that is typically a meat product and then left on the counter to get cold or to room temperature and then consuming it then. Symptoms will appear 12 to 36 hours after the ingestion of the botulism. And naturally, the severity is going to vary with the amount of toxin ingested and the person's immune response. If they are a young, healthy individual and they only got a little bit of toxin, they may just present with, having vomiting, diarrhea, and food poisoning symptoms. But if they ingested a lot of the toxin, it can kill them. Wound botulism is associated with something that caused the wound to be contaminated by the toxin. It is actually associated most strongly with intravenous substance abuse of black tar heroin. Botulism can affect infants between 3 to 20 weeks old. What happens is an infant will eat food such as honey containing spores, and these spores will germinate in their warm, moist, low acidic intestines, and the spores will then germinate and start producing the toxin. So the honey itself doesn't have the toxin, but the spores will germinate and produce the toxin. So why does that happen in infants and not adults? Well, infants do not have the acidic gastric juices that adults have. They don't develop that till much later on in life, till they're about 3 or 4. That's why I suggest not giving children under the age of 5 any honey, because all honey contains spores. Symptoms in the infants can begin as early as 18 to 36 hours after the toxin enters the body. Infant botulism mortality. Most infants fully recover with supportive care. The infant mortality rate is really very low, less than 1%. Even though it affects their cholinergic neurons, their bodies are constantly producing new cells and growing so that their body can recover rather quickly. Iatrogenic botulism is caused by accidental therapeutic toxin overdose. Botox is an attenuated form of botulism, and it is used cosmetically to reduce wrinkles because a wrinkle is caused by a contracted muscle, and the Botox will attach to the cholinergic neuron at the neuromuscular junction of the muscle causing the wrinkle, and the wrinkle will dissipate. It's also used in the treatment of cervical dystonia when you have a strong contraction of the sternocleidomastoid muscle. Sadly, botulism toxin is used in biowarfare, and inhalation of it is deadly. It's not too hard to confirm diagnosis. You'll see the organism in a laboratory culture. And you can get the culture from either a stool sample, wounds, gastric contents, the suspected food, and it'll even show up in the blood plasma. Treatment of botulism requires intravenous or intramuscular injection of botulism antitoxin, which is only available through the CDC. They'll also need supportive care, such as a ventilator, removal of stomach contents if it was contracted by ingesting contaminated food, and they may also need to be on a feeding tube while their body is recovering. Adult botulism mortality is that it's fatal without the antitoxin. Before the antitoxin, the mortality rate was at 50%, but after the antitoxin was formulated, the mortality went down to 3 to 5%. It only prevents the toxin from binding to additional presynaptic cholinergic membranes. It doesn't have any healing capability on the already damaged cholinergic neurons. During the recovery period, the damaged neurons will sprout new axon terminals, and this process takes time. So while this is happening, they're going to need the ventilator to help them breathe and possibly a feeding tube to provide nutrients while their body is trying to reconnect new axon terminals to the neuromuscular junction that was damaged by the botulism. So the timing depends on the number of neurons affected and the time it took or how soon the antitoxin was administered. Some patients may retain some residual weakness as a result of the botulism toxin, and they will require respiratory and speech therapy afterwards to retrain their muscles to breathe again and to speak again.